To vaccinate or not to vaccinate? That is the question. This is one of the biggest problems and issues that parents face when they have children. Should we vaccinate our children against measles, mumps, rubella, chickenpox, meningitis, etc.? Or should we not vaccinate them and them maybe catching the disease? One of the biggest issues right now and the biggest immunization problem we're having is the HPV vaccination, the vaccination against the HPV virus. A lot of parents don't think that their daughters, sons should have this because there's really no proof of the benefits of having this vaccine. So, do you immunize your child against this or not and see what happens? Well, according to Dr. Federer in the article, Vaccines, Pros and Cons, it is a subject that evokes strong emotions and usually stirs up a heated debate regarding the efficiency, reliability, and safety of vaccines. Doctors tell us that the vaccines are safe, but a lot of parents do not even know why their child gets the immunization. They just give it to them because the doctor tells them to and it'll keep them healthy. This is true. I work in a doctor's office. I give immunizations to children every day. Yes, it sucks giving a child a shot. It sucks giving a child 4 shots. It sucks giving a child 6 shots. I don't give any more than 6 shots at a time. But I would rather the child be healthy and in pain for a few hours. Give them Tylenol, Motrin. It takes away the pain and the fever that they might get as an adverse side effect of the vaccine. Rather than get the disease down the line and they have memory issues. Some children become paralyzed, some become hospitalized, some may even die because they get the disease instead of their parent giving them the vaccination. I know parents have religious reasons for not wanting to give their child a vaccination. Some have spiritual reasons. Some think there's a link to autism, which, truthfully, there's been no medical evidence that vaccines are linked to autism. And not all states require children to have vaccines. So why should I vaccinate my child in this state if that state over there doesn't need to vaccinate their child? Yes, I understand this. I get this. But I, as a parent, would rather have my child in pain for a few hours a day after their doctor's appointment, hate me for probably a couple days because they were in pain, give them some Tylenol, Motrin, make my day miserable because their day's miserable, rather than become adversely ill down the line. There was a rise in mumps and measles at The Ohio State University. It was all over the news. It was on CNN. It was on MSNBC. It was on our local news stations. And it was all came down to students who came from other countries, other states, who did not get immunized against these vaccines. So they brought the disease with them and it started to spread, which causes issues because I don't want my child to go to school and catch measles, mumps, chickenpox, rubella, and get ill because another child's parents decided they didn't want to give their child a vaccine. I know this is a very controversial issue. If you want to give your child vaccines, I'm all for it. If you don't, please research up and see. Make sure you know why you're not giving your child this vaccine, why you're against this vaccine, the pros and cons of getting the vaccine. I really hope that parents do immunize their children. It is a major debate. Should we? Shouldn't we? Are they linked to ADHD? Are they linked to autism? I did a paper on this. There was no medical evidence of any of the vaccines being related to ADHD or autism. The rare adverse side effect most patients get, swelling, redness to the injection site. When this happens, you apply a little ice. Give some Tylenol, Motrin. when there is documented evidence that the vaccines cause other major health issues, then maybe my view will change. But right now, I have seen diseases at bay because vaccines are given. I do not feel a child's immune system is strong enough to fight any disease without help. So yes, I immunize my child. Thank you.